Good morning. Myself, Dr. Madhan, working as assistant professor in the Department of Radiology. Today, we are going to discuss about Orads MRI. Introduction. What is Orads? Orads is Ovarian Adnexal Imaging Reporting Data System. It is a clinical support system for standardized description and classification of ovarian and adnexal lesion. It has two complementary arms. One is USG, which is a primary imaging modality with higher sensitivity. And second one is the MRI ORADS, which is a secondary tool with higher specificity. And the goal of ORADS is to optimize ovarian cancer outcomes while minimizing unnecessary surgery in patients with adnexal lesions. There are totally 6 categories in ORADS. First one is the incomplete evaluation, in which case the scan could not be completed or post contrast MRI was not taken. Then score of 0 is given. And normal ovaries with like follicles, hemorrhagic cyst less than 3 centimeter will be given a score of 1. And almost certainly benign lesions with less than 0.5% risk of malignancy, score of 2 is given. And low risk category lesion with less than 5% risk of malignancy, score of 3 is given. And intermediate risk, where the risk of malignancy is around 50%, score of 4 will be given. And high risk, in which case 90 and more than 90% risk of malignancy, score of 5 is given. MRI lexicons. First is the signal intensity. T2, in the T2, lesion can be either hypointense, intermediate, or hyperintense. This will be considered in relation to the iliopsoas muscle and urine or CSF. Iliopsoas muscle will be usually considered as T2 hypointense, and urine or CSF will be considered as T2 hyperintense. And for T1 also, lesion can be either hypointense, intermediate, or hyperintense in relation to the iliopsoas muscle and fat. In which case, iliopsoas will be hypointense and fat will be hyperintense. And in case of DW images, lesion can be either high or low signal intensity in relation to CSF and urine. And lesion types, lesion can be either a cystic lesion with or without solid component, which can be either unilateral or multilateral, or it can be a solid lesion, in which case 80% solid enhancing, 80% of the lesion should show solid enhancing areas. MRI lexicons, fluid descriptors. The fluid can be either simple fluid or it can be non-simple fluid. Simple fluid means it will be similar to CSF, which is like T1 hypointense and T2 hyperintense, and DWA it will be DWA and ADC hyperintense. And in the non-simple fluid can be either endometriotic, hemorrhagic, proteinaceous, or lipid containment. In which case, endometriotic lesion will fluid content will appear hyperintense in T1 weighted image, or hypointense or intermediate signal intensity in the T2 weighted image, which is known as shading sign. And in the hemorrhagic, which is variable, in case of chronic hemorrhage, both T1 and T2 will be hypo, and in case of subacute hemorrhage, both T1 and T2 will be hyper, and in case of acute hemorrhage, T1 will be hyper and T2 will be hypo. And in case of proteinaceous, invariably T2 will be hypo and T1 will be either hypointense or hyperintense based on the amount of percentage of protein and fluid content. And lipid is usually, as we all know, it will be both T1 and T2 hyperintense. Solid components, any part of the adnexal lesion that is not fluid will be considered as solid component. It is divided into either it can be a solid tissue or can be other solid component, which is known as non-solid tissue. Solid tissue is a part of the lesion which enhances after contrast administration and exhibits one of the morphological features like papillary projections in case of serous tumors or mural nodule, or it can be an irregular septa or wall in case of borderline and malignant lesion, and large solid portions. A non-solid tissue, any other solid component, the other solid component that do not fit the definition of solid tissue, and it includes thin or thick smooth septations or walls, blood clot, non-enhancing debris, fibrin strands, and fat. DCE-MRI. DCE-MRI is dynamic contrast enhanced MRI. DC is the time intensity curve which is generated by placing one ROI within the area of early solid tissue enhancement within the lesion and another on the outer myometrium. And this is the signal intensity curve. X-axis is the time and Y-axis is the signal intensity. Here we are able to see in the normal myometrium, in the early phase, there is a steep rise in the signal intensity due to increased enhancement, followed by a plateau kind of phase. And in case of high-risk lesion, the initial steep increase in signal intensity will be more than that of the myometrium. And in this case, it will be considered as high risk. In the intermediate, the initial steep rise will be less than that of the myometrium. In that case, it will be considered as intermediate risk. And in the low risk category, lesion will be doesn't show any steep increase in signal intensity after post-contrast enhancement, and it will be considered as low risk. In first category of lesion, first of all, we should see whether it is a unilateral lesion or multilateral lesion. In case of unilateral lesion, next thing to be seen is a smooth, whether it is showing smooth wall enhancement or without smooth wall enhancement. If it shows smooth wall enhancement, then we should see the fluid characters, whether it is a simple fluid, whether it is which appears T1 hypointense and T2 hyperintense, or it is an endometriotic, in which case it appears T1 hyperintense and T2 can be either intermediate or hypointense. Orads score of 2 will be given. And if it is a proteinaceous content like in the mucinous cystadenoma or hemorrhagic like in malignancies, then Orads 3 will be given. Proteinaceous will be T2 hypointense and T1 it can be either hyper or hypointense based on the composition of amount of water and protein content. And hemorrhagic will be variable as we had seen before based on the age of the blood particle. And overall score of 3 will be given for both hemorrhagic and proteinaceous. Here we are able to see endometriotic cyst is given a score of 2, but hemorrhagic cyst are given hemorrhagic cyst more than 3 centimeter will be given a score of 3. This is because certain malignant lesions will show hemorrhagic content within the cystic component. So only it has been given a score of more than that of endometriotic cyst. And when there is no wall enhancement, then whatever kind of fluid is there, we should give the score of Orads 2. Next is the fat containing lesion. In the case of fat containing lesion, we should look for any enhancing tissue is there or not. In case there is no enhancing tissue, then it's directly mature teratoma and a score of Orads 2 is given. And there is a small enhancing nodule like a mural nodule or Rokitansky nodule, then Orads score of 2 is given. And in case of large enhancing tissue with irregular borders, then Orads score of 4 will be given, which will be usually a case of immature teratoma or teratoma with malignant degeneration. In the case of teratoma, either squamous cell carcinoma or clear cell carcinoma can develop after a long time. And in case of dilated fallopian tubes, we should look for the fluid, how was the fluid, whether it is simple fluid or non-simple fluid, then there is any enhancing tissues is there or not. If it is a simple fluid and there is no enhancing tissue, then overall score of 2 will be given, which will be usually a hydrosalpinx. And in case of non-simple fluid like endometriotic fluid or it can be hemorrhagic protein, then or in case of thick, smooth, enhancing wall or septa, like in case of pyosalpinx, then overall score of 3 will be given. Enhancing solid tissue, in case we should look for the T1 and DW signal characteristics. If it is a homogeneously T2 hypointense or DW hypointense, then Orad score of 2 will be given. So these kind of imaging characteristics will be seen in the fibromas and fibroticomas. In case of all other lesions, except these fibroma kind of or fibroticoma kind of lesion, should look for the DCMRI. And in the DCMRI, particularly the time intensity curve based on the calibration done by the software. And in case where the DCMRI was not available, we can look for the enhancement of 30 to 40 seconds on a non-DC MRI, which is usually a T1 wave sequence, post T1 wave post-contrast sequence. And in the DAC time intensity curve, there are three categories of curves. Either can be a low risk with no steep rise in the initial phase, that can be an intermediate risk, which is like initial steep rise will be less than that of outer myometrium, or it can be a high risk, which initial steep rise will be more than that of the outer myometrium. The low risk will be given a score of 4 and intermediate risk will be given a score of 4, and for high risk lesion, score of 5 will be given. And in case of enhancement at 30 to 40 seconds, and when we are not able to see, do DC MRI, in that case, we can look at the enhancement at 30 to 40 seconds on non-DC MRI, which case the enhancement should be compared with the outer myometrium. And when the enhancement is less than that of the outer myometrium, Orad score of 4 will be given. And when the enhancement is more than that of outer myometrium, then score of Orad 5 is given. And Orads 1, in this case, physiological observation in the premenopausal woman will be considered like follicles less than 3 centimeters, hemorrhagic cyst less than 3 centimeters, or a corpus luteal cyst less than 3 centimeters. And first is the case of follicle, in which case this is an axial T2 weighted image, and here we are able to see a T2 hyperintense lesion with T2 hypointense wall. And in the axial FATSA T2 weighted image, lesion shows the same signal intensity like that of T2 image, still appearing hyperintense. And in the axial T1 FATSA sequence, the lesion appears hypointense. And in the axial post-contrast T1 weighted image, the lesion shows smooth wall enhancement with no internal solid enhancing tissue. And second is the hemorrhagic cyst. In this case, we are able to see a cystic lesion which appears on the T2 axial position, axial T2 weighted image, in which the lesion appears hyperintense. The axial T1 weighted image, here also the lesion still appears hyperintense, and in the T1 fat cell sequence also, lesion appears hyperintense. And in the post-contrast sequence, we are not able to see any type of enhancement within the lesion. And third is the corpus luteal cyst. In this case, we are able to see a central T2 central hyperintense signal and intermediate signal crenated margins on the periphery in the T2 weighted image. And in the T1 weighted image, lesion appears homogeneously, even hypointense. And in the T1 fat set axial image also, lesion shows similar type of signal intensity. And in the post-contrast, we are able to see a crenated enhancing ring is seen surrounding the fluid area of the lesion, so which is suggestive of corpus luteal cyst. Second is the Orads 2 category of lesion, which is almost certainly benign with a positive predictive value for malignancy less than 0.5%. And here, this will include unilocular cyst with any type of fluid content, but there should not be any wall enhancement or no enhancing solid tissue. And first, we are able to see a 3.5 centimeter hemorrhagic cyst with the fluid level in the T2 weighted image, with the dependent portion appearing hypointense and non-dependent portion appearing hyperintense. And in the T1 weighted image, lesion appears hyperintense. And in the T1 fat set image also, lesion still appears hyperintense. And in the T1 post-contrast image, the lesion doesn't show any type of enhancement. And second will be the category which will be unilocular cystic lesion with either simple or endometriotic fluid content. Here the smooth wall enhancement can be seen, but there should not be any enhancing solid tissue within the lesion. First is an example of a unilocular cyst with a simple fluid, and here we are able to see a cystic lesion with T2 hyperintense contents in the axial T2 weighted image, and in the T2 FATSAT image also lesion appears hyperintense, and in the pre-contrast T1 weighted image, lesion appears hypointense, and in the post-contrast T1 weighted image, there is a smooth ring and smooth wall enhancement is seen. And second is the endometrium. Here we are able to see a T2 hypointense lesion, and in the T1 weighted image, lesion appears hyperintense, and in the T1 FATSAT image also, still the lesion appears hyperintense, and in the post-contrast T1 weighted image, which are able to see here, smooth thick wall enhancement. And lesions with lipid content with no solid enhancing tissue or a small amount of solid enhancing tissue can be seen. And here is an example of a dermoid cyst. And this is a T2 weighted image. Here we could see the degrees in we could see a T2 hyperintense lesion with the intermediate signal intense area and the dominant portion. And in the T1 weighted image also, lesion appears hyperintense. And in the FATSAT, in the T1 FATSAT image, most of the part of the lesion shows signal suppression. And in the post-contrast image, there is no obvious enhancement seen within the lesion. And fourth category of lesions which are included in Orads MRI are lesion with homogeneously T2 dark or DW dark solid tissue. And fibromas, first one is the fibroma. Here we are able to see T2 hypointense lesion, which appears hypointense in the DW also. And in the pre-contrast T1 weighted image also, lesion appears hypointense. And in the post-contrast T1 weighted image, the lesion shows minimal enhancement. However, since the lesion appears homogeneously dark both in DW and T2, score of 2 is given. And so, fifth category of lesions which are included in Orads 2 are dilated fallopian tube with either with simple fluid having thin or smooth wall or endosalpingeal folds, and there is no enhancing solid tissue within the lesion. First is a case of simple hydrosalpins. Here is we are able to see a dilated tubular structure with incomplete septa, and the fluid content was appearing T2 hyperintense, and in the T1 it is hypointense, and in the post-contrast sequence, we are able to see the smooth wall and septal enhancement. And sixth category of lesion is a para-ovarian cyst with any type of fluid which can show a thin smooth wall or enhancement, but there should not be any enhancing solid tissue within the lesion. Para-ovarian cyst, here is a case of para-ovarian cyst in the left adnexa, which is separate from the ovary and appears hyperintense in the T2 weighted image and hypointense in the T1 weighted image, and in the pre-contrast weighted T1 weighted image also, T1 post-contrast image also appears hypointense, and in the post-contrast, there is no enhancement within the lesion. The third one is the Orads category 3 of type of lesion, which is almost certainly benign with a positive predictive value for malignancy of around 5%. And here there will be three category of lesion. First one is the unilocular lesion with proteinaceous, hemorrhagic or mucinous type of fluid. There can be smooth wall enhancement can be there, but there should not be any internal solid the enhancing solid tissue. First is a case of a unilocular cyst, which appears hyperintense in both in T1 and T2, and in the both contrast T1 weighted image. Pre-contrast T1 FATSAT image also lesion appears hyperintense, and in the post-contrast T1 weighted image, the lesion shows smooth wall enhancement. The case of unilocular cyst with hemorrhagic content. And second is the multilocular cyst with any type of fluid other than the lipid component. And can show a smooth septae and wall with enhancement, and there should be no enhancing solid tissue. And here is a case of mucinous cyst, multilocular cystic lesion, which with the locules, few of the locules appearing hyperintense and few of the locules appearing hypointense on the T2 weighted image. And in the T1 weighted image, the areas with certain locules which appear hyperintense only T2 weighted image appears hypointense and which appear hypointense in the T2 weighted image appears hyperintense in the T1 weighted image. And in the post contrast, we are able to see the smooth wall and septal enhancement. And, and this varying signal intensity in the east of the locule is very typical of mucinous cyst adenoma. And third category of lesion is the lesion with solid tissue, excluding the homogeneously T2 dark or DW weighted DW hypointense lesions with lower risk time intensity curve and DC MRI. And here is a case of Brennan's tumor. We are able to see a T2 hypointense lesion with two areas of hyperintensity, and in the axial TW image, we are able to see few hyperintense areas, patchy areas of hyperintensity within the lesion. And in the time intensity curve, the lesion shows a lowest risk time intensity curve. And the enhancement also, it's less than that of the outer myometrium. Since we are able to do the DCMRA, it a score of 3 is given. In case of DC, where DC is not available, then we can compare the enhancement of the lesion with the outer myometrium. In that case, only score of 4 and 5 will be given. And Orads 4 category, which is the intermediate risk with a positive predictive value for malignancy around 50%. Here, this will include lesion with solid tissue, excluding the homogeneously T2 dark or DW dark lesions with intermediate time risk, time intensity curve and DC MRI. The axial T2, and the first is the low grade serous papillary tumor. Here we are able to see the unilocular cystic lesion with the papillary projections and solid areas and nodules are there and, within the lesion. And these solid areas appears hyperintense in the DWMU, and the lesion shows an intermediate risk type of DAC curve, the DCMR. And in the post-contrast images, lesion shows enhancement almost similar to that of the outer myometrium. So since DC was done, in this case, we should consider the DIC curve, which is a moderate risk curve, and so score of 4x4 is given. And lesion with solid tissue, where the DCMRA, in the case where DCMRA could not be done, then we should look for the enhancement of the lesion with outer myometrium at 30 to 40 seconds. And here is a case of ovarian endometrial cancer, and there is a solid area within the abdominal solid lesion, which appears intermediate to hypointensity signal in T2 weighted image, shows strong diffusion restriction, and in the axial T1 weighted pre-contrast image, lesion still appears hypointense, and in the post-contrast T1 weighted image, the lesion shows an enhancement less than that of the outer myometrium. So score of 4 is given. And lesion with lipid content but contains a large volume of enhancing solid tissue, like rheumatoid with squamous cell carcinoma, malignant degeneration, with the squamous cell carcinoma, development of squamous cell carcinoma. In this lesion with lipid content, there is a lesion with lipid content which appears T1 hyperintense in the non-dependent portion, and there is also an intermediate signal intense area in one of the portion of the lesion, and the corresponding area in the T1 fat set sequence. And in the post-fat sequence, you could be able to see a mild amount of enhancement in the solid area. So this is a lipid-containing lesion with a large amount of solid enhancing area. So overall score of 4 is given. And finally, Orads 5 category, which will include high-risk lesions with a positive predictive value for malignancy of more than 90%. The first one is here we will be having two sets of lesions. One will be based on the DC MRI, DAC curve, and another one based on the enhancement of the lesion compared to the myometrium. First one is the ovarian endometrial carcinoma. Here we are able to see a predominantly solid lesion with a cystic component. And in the T2 weighted image, the lesion appear hyperintense. And in the DW image, the lesion shows patchy areas of hyperintensity. And in the DIC, we are able to see a high-risk category, high-risk type of time intensity curve. And in the post-contrast, the enhancement of the solid tissue is more than that of the outer myometrium. So score of 5 is given. And in case where the TC MRI can't be done, it should compare the enhancement of 30 to 40 seconds. And here is a case of an annulus cell tumor, the solid lesion which appears intermediate signal intensity in the T2 weighted image, and the corresponding ADC DW images, the lesion appears hyperintense. And in the pre-contrast T1 fat sampling images, the lesion appears hypointense, and the post-contrast lesion shows enhancement more than that of the outer myometrium. So score of 5 is given. And before finishing the topic, let us see few examples. The first is a case of a multilocular cystic lesion. And this is an axial T2 weighted image. And here we are able to see the multilocular cystic lesion in the right adnexa, with each of the locule having a variable signal intensity and smooth T2 hypointense septa and wall. And in the T1 non-facet axial images also, the lesion shows locules of intermediate signal intensity. And in the T1 facet coronal image, we are able to see contents of the lesion, contents of the locule appearing intermediate signal to hyposignal intensity. And in the post contrast, we are able to see the smooth wall and septal enhancement without any internal enhancing solid tissue. So overall score of 3 is given. This is actually a biopsy proven case of mucinous cystadenoma. The second one is a case of multilocular cystic lesion, abdominal extending from the pelvis into the lower abdomen. And there is a T2 intermediate signal solid area in the lower portion of the lesion, showing indistinct fat lines with the adjacent uterus. In the corresponding ADC image, corresponding ADC axial image at the level of the solid area shows solid areas appearing hypointense in the DW ADC image, suggestive of diffusion restriction. And in the T1 pre-contrast, the lesion, solid area of the lesion appears intermediate signal intensity. And in the post-contrast, lesion shows solid area of the lesion shows enhancement more than that of the outer myometrium. So score of 5 is given. And case number 3, this is an unilocular cyst with axial T2 weighted image showing a T2 hyperintense lesion, and the T1 weighted image lesion appears hypointense. And in the pre-contrast T1 weighted image, still the lesion appears hypointense. And in the post-contrast T1 weighted image, smooth wall enhancement alone is seen. There is no internal enhancing solid tissue. So this is a simple unilocular cystic lesion with smooth wall enhancement and simple kind of fluid. So overall score of 2 is given. There is a solid lesion, which which appears intermediate to high signal intensity in the T2 weighted image, and in the corresponding lesion show ADC images. Lesion appears shows areas of hypointensity suggestive of diffusion restriction. And in the pre-contrast image, lesion appears intermediate signal intensity. And in the post-contrast T1 weighted image, you can see the areas of enhancement within the lesion, which is more the enhancing areas shows enhancement more than that of the outer myometrium. So score of Orads 5 is given. And this came out to be a granulosa cell tumor in a postmenopausal woman. Actually, a granulosa cell tumor in postmenopausal woman. This patient presented with postmenopausal bleed. The fifth is an example of a ovarian solid lesion. The solid lesion appears relatively homogeneous with few homogeneously intermediate to high signal intensity and few thin T2 thin hypointense thin septations are seen within the lesion. And in the T1 weighted image also, the lesion appears homogeneously T1 hypointense to intermediate signal intensity. And in the diffusion DW image, lesion appears homogeneously hyperintense, suggestive of diffusion restriction. And in the post-contrast images, we are able to see the enhancement of the lesion is less compared to that of the outer myometrium. So This is a solid lesion, actually solid lesion with enhancement less than that of the outer myomatome. So in that case, overall score of 4 is given. This is actually a case of dysgerminoma, which is a counterpart of seminoma in the male. And as we all know, seminoma will be usually a homogeneous tumor with few thin fibrous septa forcing within the lesion. Otherwise, the lesion will be relatively homogeneous in case of seminoma. Similarly, dysgerminomas also will have a homogeneous appearance in the T2 weighted image and in the post contrast images also. So here the score of 4 is given since the enhancement is less than that of the outer boundary. So basically, first of all, you should see whether it is a cystic lesion or solid lesion. In case of cystic lesion, whether it is a unilocular cystic lesion or multilocular cystic lesion. If it is a multilocular cystic lesion without any solid enhancing area, any type of fluid other than lipid should be considered as Orads 3. And in case of unilocular cystic lesion, it can be without any enhancing solid tissue, it can be either Orads 2 or Orads 3. In that case, when there is no wall enhancement, any kind of fluid can be considered as Orads 2. When the wall enhancement is there, we should look for the fluid characters. If it is simple or endometriotic, then it is Orads 2 category. Or if it is proteinaceous or hemorrhagic, then Orads 3 will be given. In case of fat containing lesion, it can be either Orads 2 lesion or Orads 4 lesion. There is a small enhancing tissue or enhancing tissue, there is no solid enhancing tissue, then score of 2 is given. And in case of malignant degeneration in dermoid cyst or immature teratoma, Orads score of 3 will be given. And in case of dilated fallopian tube, hydrosalpinx will be given a score of 2. And hematosalpinx and pyosalpinx will be given score of 2. And when there is solid enhancing tissue, we should rule out, we should look for T2 homogeneously, T2 hypointense or DWA hypointense lesions are actually fibromas or fibrothickomas. All other lesions should be, all kind of lesions should undergo DC MRI. In case where DC MRI is not possible, look for the T1 white sequence at 30 to 40 seconds. And based on that, overall score of 3, 4, and 5 will be allotted.